it's a great event to hear what other communities are doing, some of our partners. I know we share a lot of the same clients, and so it's really exciting to hear what some of the other communities are doing, new ideas, thinking outside of the box, and we like to do that as well. So today I'm going to share a little bit of information about who we are as Stella Nation, if you don't know who we are, Stella Nation Health, as well as some of the highlights of some of the events that we've hosted throughout the year for our clients. So for those of you who don't know, the Stella Nation Health Services are located in Chilliwack, BC. We have our central office there, and we serve 11 of the Stella Nation bands up and down the river. I won't name all 11 of them because I may forget one of them. Soon enough I'll be able to list them off. But we deliver mandated programs and services ranging from health promotion and disease prevention, as well as support services to all First Nations people. So our targeted funding is for on-reserve clients, but we serve anyone that walks through our door. Like I said, we share clients with many of the other health services like Seabird Island, Chehalis, and people are always moving from reserve to reserve, and of course having babies with people from those different communities. We also operate a 15-unit assisted living facility. Has anybody been to the Elders Lodge? A few people? If you haven't been there, visit. It is beautiful. We have some information set up today. Michelle was at the table. Beautiful post and beam, 15 facilities there, huge bedrooms. If you haven't visited, go. I'm hoping to reserve my spot there when it's time. That's where I want to stay. As well, we also have a 3-chair dental clinic, and that's open to everybody and anybody. So if you need a dentist, come and see us. It's an excellent dentist office. Apparently we have some pretty high-tech x-ray and TVs and all that good stuff. I've heard it's a good place to go. That's where I go. As well, we have an Aboriginal Head Start and Daycare program, and it's an education program, and it's very easy and accessible not only to our employees, but to the people in the lower part of the valley who are working, and it also incorporates a lot of culture and language into the programming, so a lot of the parents, including myself, are very happy with that facility so close to Stella Nation Central. We're also actively involved in the health governance process. As Janine has mentioned, we are involved as she is in that process, and she was selected to sit as a member of the First Nations Health Directors Association. So please visit the website, learn more about it. It's very important in our process to move health towards run and operated by our First Nations people. In addition, Chief Maureen Chapman represents the Stella Nation communities on a regional level at the Fraser Health Caucus. Both these associations and caucus form a key part of the health governance process. Unfortunately, Chief Maureen Chapman wasn't able to join us today. She's got quite the busy schedule. Like Doug, probably has almost 2 or 3 phones. So some of the highlights to Stella Nation, we are involved in the health transfer agreement, and ours expired on March 31st. So in preparation for the new funding arrangement with Health Canada, which was a 10-year agreement, we underwent a review of programs and services from 2006 to March 2011, which is a huge process, as you can imagine. So for 2011 to 2021, our 10-year community health plan for all 11 Stella Nation bands were developed and submitted as a requirement to enter into the funding arrangement, which we have now received. Yay! So 10 more years of new programming developed to target the needs of our community, to make sure that they're moving forward and people are getting the services that they need and require, and it is culturally appropriate. As well, some of our new programs, we have an Aboriginal Infant Development Program, which is funded by MCFD, and it's transitioned recently to Stella Nation Health as of August 1st from the Fraser Valley Child and Development Center. So it provides a home-based and home visitation program that is culturally appropriate, and most of the clients that we see are either at risk of developmental delay or they are diagnosed with a disability. So a lot of these families can come into Stella Nation, they can access these services through any of our satellite offices at each of the band offices, through the workers or CHW's, community health workers. As well, we're currently in the process of revamping our day treatment program. I know we heard a little bit about Riverstone, and we're really excited to see what that partnership will look like with Stella to increase access to all the members in our 11 bands. As well, with our Aboriginal Diabetes Initiative program, we have a few highlights from that as well. We've done a food skills program. Our community health workers went and held 2 separate food skills courses. One was offered in the east and one was offered in the west. And families were invited to kitchens, and they taught about all different kinds of food groups, meal planning, to avoid all the nasty stuff in the middle that's filled with all the bad stuff, right? The stuff that we love. As well, we partnered with Seaward Island Mobile Diabetes Clinic to offer screening and appointments at each of the communities. So thank you very much. Our hands will go up to you. We're looking forward to booking some more clinics in the winter months when it's easier to travel to us in our communities. As well, we had a Get Fit for Life program. So we did contract a fitness group, and they came in and did some exercise programs with us. And if you would believe, that guy put a sign on our elevator saying take the stairs. And you'd be surprised, I've been monitoring it, and some people ignore that sign, so I think we're going to have to put some red tape across that elevator or something. But there was a stair challenge that was done with some of our staff, and it was a lot of fun. So much so that when Lyle, our contractor, left, the staff continued the stair challenge, and you could hear the music blaring from the stairs as they were rocking out doing their stair challenge. As well, they did another stair challenge. If anyone's seen those stairs at the Prospera Center, they look pretty daunting. There was also a stair challenge there, so that was a lot of fun. So we have lots of health events as well that we collaborate, and looking to collaborate with some of the other organizations. But I wanted to ask Mr. Eddie Gardner to stand. I put my hands up to Eddie Gardner. He was one of the main people who helped to coordinate the second annual Indian Residential School Conference. So entitled the 2011 Journey of Heroes Conference, workshops focused around traditional healing and wellness and truth and conciliation. 200 people attended all parts of the 3-day conference. Also in attendance were traditional healers, representatives from school districts, educational institutions, churches, and social services agencies. So like Auntie Millie and so many of the other speakers said, it's such an important event for our people, especially our elders and any of those survivors that attended residential school, because as we all know, those experiences affect many of our generations. And for me, I'm third generation from my grandparents who attended residential school, and I see how their experience has affected my generation and the generation that my children will belong to. So our hands go up to you, Eddie. Thank you so much. As well, we participated in the Elders Conference, which was lots of fun. So our health staff, anyone who was medically trained, was seconded from their position to go and help in the restroom. And I thought, oh, this will be fun, visiting with elders and helping them with their medications. But it turned out to be a big need, and I'm really glad that we went. There were quite a few elders that were not feeling well. Some of them told us that they were so excited to come and attend this event. They took a 20-hour bus ride, non-stop, all the way down to Abbotsford. Forgot the medication, they were so excited. And so we were definitely in need there in the restroom. We sent many elders to the hospital so that they could get all fixed up and ready to come back and party with all of their friends. So I'm really glad that our team went. It was a good time. As well, we hold our annual Children's Festival. Last year it was held at the St. Mary's site, and this year it was held on the Sol Nation Central Grounds. Years previous, we rotated all around. We have had it here in Sumas, so I'm sure it'll be here again soon. We also have a Christmas hamper drive every year, and this is made possible by all the Sol Nation departments and our partners in the community, different organizations. We provide hampers to those families in our community who are in need, and we're looking for donations and support this year. So if you're looking to help us with our hampers, come and let us know. And finally, we're looking to improve our internal and external communication process. We really want to make sure that the programs that we're running and those that are available to our community members are known in the communities, and that newsletters, information are not only making it onto the coffee tables of our community members, but also onto their computers, because I know many of you in the room probably have cell phones that have internet access. So we are now on Twitter, and we are now on Facebook. So go ahead and look us up. We are there, and you can also see us on our website. So we're entering a digital age where we can put the bug in everybody's ear. You'll hear more about Hub from Chloe Adele later. I'll let her share a little bit about that program, as well as Linda Kay and the partnership that they work in as well. So thank you so much. If you want more information about Sol Nation Health Services, please feel free to drop by, look at our website, or come see us afterwards. OCM, thank you.